Welcome. Today we're going to run through IM injections. So you may or may not have done one of these before, and what we're teaching today is just best practice. So once again, the first thing I'm going to do is sanitize my hands, and while I'm doing that and waiting for it to dry, I've opened up my CPGs and I'm using 2.1 asthma CPG. My patient has been given a nebulizer and has had no improvement, so we'll be administering 0.5 milligrams of IM adrenaline. So what I can do is, while I'm waiting for my hands to dry, is just check that I've got my equipment. So I've got my patient here, got my sharps open and ready to go, a drawing up needle, a 3ml syringe and a sharp needle, as well as my sticker. I'm going to put on some gloves, and while I'm doing that I'm going to ask the patient permission and just get their consent. So I'm going to give you some adrenaline because your asthma is not improving, and I'd like to give that to you in your lateral thigh, that's the side of your thigh, to help with your asthma that isn't improving. So is that okay? Fantastic. So then, now that I have my gloves on, I'm going to do my drug check. So there's different ways you can do this, but I'm going to give it to my partner and just say, can you please read that out to me?
Got adrenaline, it's 1 milligram and 1 mil, and it expires 07/2030.
Fantastic. I always like to read it back in a different order so that I'm not just parroting what I've heard. So expiry 07/2030, adrenaline 1 milligram and 1 mil. Now according to the CPGs, I need to give 0.5 milligrams, which will be 0.5 mils. I'm going to prepare my syringe. I just find it easiest to pop it out of the plastic rather than fiddling around with the end. And I have a 3ml syringe here, and I'm going to draw up 0.5 of a mil, which is 0.5 of a milligram of adrenaline. Before I draw it up, I'm going to place my sticker onto the syringe and keeping it away from the numbers so it doesn't cover that up. And that means that I can do my final check with my partner that I've got the right medication and the right amount. So adrenaline is notorious for sticking up in the top here. So you can either do a circular motion on the table like I just did, or you can also do that. All of those will help get the medication down into the ampule. I'm going to pop it away from everybody. And I now have a sharp exposed, so I'll just let my partner know that I have a sharp exposed. If you're a bit shaky like me, I always find it useful just to put my little fingers together, just to hold while I'm putting that in. Make sure I can see the numbers and draw up just over 0.5 mil of adrenaline. Okay, I'm putting that sharp away. And then with the air bubble at the top, I'm taking the plunger to 0.5 of a mil. I'm recapping my blunt because it's notoriously hard to get a blunt off without a cap on the top. So I'm now checking with my partner. So under the asthma guideline, I'm giving 0.5 of a milligram IM, and I can repeat every 10 minutes if required. So can you just check there is 0.5 of a milligram?
0.5.
Okay, and that's 0.5 of a mil of adrenaline. So now I can take off my blunt, which goes in the sharps container because it's still considered a sharp, and put on my 22 gauge needle. At this point I would just ask consent again from the patient. So are you okay if I just pop this injection into your thigh at the moment? Good, okay. So with an IM, it's slightly different to the subcut video. So what we're wanting is the lateral thigh, and we're wanting between the knee and the hip, that middle third, and between the top of the thigh and the bottom thigh, that middle third. So if you can imagine the thigh is chopped up into 9 pieces, we want that centre of the 9. We also don't squeeze for an IM injection. In fact, we use what's called a Z-track method. So we actually use our dominant hand We pull down on the skin, like so, to put the injection in. Lateral thigh is where we want to choose, if we can, that is the best place. And the other place that we would give an IM injection is the deltoid. So I've checked my jug, I've checked with my patient. I now, sharps exposed, and I'm pulling down on that Z track. Okay, and we're going straight in, plunging it in. We do not need to draw black in the lateral thigh. Administer the medication, and as you let go, once the needle is out, you're actually creating a band-aid effect with the skin over that site. So no rubbing once again, no need for plasters or anything like that. We just leave that site as is, and then we record the medication and the time in our EPRF. Thank you.